This is a demonstration of the Applied Neuroscience Incorporated's effective connectivity module that is now inside of NeuroGuide, at least for the surface effective connectivity. Now, in functional neuroscience, there are three categories of connectivity. Category 1 is referred to as structural connectivity, such as what you see with a structural MRI. The other is called functional connectivity, which gives you correlations or coherence of coupling between distant nodes, for example, of networks, and gives you a measure of the extent to which there is a coupling between nodes or locations on the scalp surface. The third form of connectivity is referred to as effective connectivity, which is a measure of the magnitude and direction of information flow in coupled nodes of networks, or if they're not coupled, then there will not be any information flow. The method that we use is referred to as the phase slope index, developed by Guido Nolti in 2008, and subsequently has been tested in numerous publications and compared to the other method that's often used for effective connectivity, referred to as Granger causality. The Granger causality is less accurate, especially when there's noise, and many times it fails completely in properly estimating the flow of information. It also is more complicated to calculate, involving autoregression and other methods. The phase slope index is fast enough to calculate so that one can implement it in neurofeedback. And we will be doing that. We will be implementing phase slope index in both the surface neurofeedback modules inside of NeuroGuide as well as the Loretta neurofeedback modules. But for now, let me show you what the surface effective connectivity is as a measure of the flow of information in the brain. This is a patient that is in the NeuroGuide demo, obtained by clicking Help, enter demo mode. I've already done that. This is the patient's EEG. He's age 55, eyes closed EEG, was struck with a bat in the right parietal lobes. He has spatial neglect, does not shave the left side of his face, does not write on the left side of pages, doesn't see things on the left, and also he has paralysis on the left side. And you can see these large theta rhythms that are present in C4 compared to C3, and P4 compared to P3, etc. And I won't go through all the details of editing, but suffice to say that artifact-free segments of EEG have been selected for the purpose of this analysis with 0.95 test reliability, which is at least 0.9 is recommended. To activate the effective connectivity, you click Report Selections, and effective connectivity for the surface of the scalp is seen here in the lower right. This is effective connectivity, so you select that. We can look at both. For now, we'll look at Z-scores, and we can also look at raw scores. I want to also show coherence, so you can see the complementary aspect of coherence versus the effective connectivity. Coherence, as I mentioned, is functional connectivity, and in this case, phase slope index is effective connectivity. So I'm just going to click OK. Then I'm going to go to Report, Generate Analyses. And now we can see the analyses. I'm going to resize this window a little bit. This is delta coherence, Z-scores, and you can see there's hypercoherence, particularly on the left. There's hypocoherence where the damage was here in P4. This is more obvious in the theta frequency band. You can see that there's decoupling or reduced connectivity in the right parietal, right central region with respect to other parts of the brain. For example, this is CZ shows low connectivity to C4 and P4. Here C3 shows low connectivity between C3 and C4, C3 and P4, etc. That's how you interpret this map. Here, for example, FP1 has hyperconnectivity or elevated connectivity, largely because it's likely to be compensatory since there's no damage to the left hemisphere. But there's hyperconnectivity with respect to T5. There's T5 over here. You can see that there's hyperconnectivity of T5 with respect to FP1, which is here. And he's fairly normal in the alpha bands. He has hyperconnectivity a bit, but in general, the higher frequencies, he's fairly normal. And you can see that in the records itself. There was some disconnection there we saw in the right frontal at these higher frequencies. This, for example, is the beta 3, beta 2, beta 1, high beta, etc. So those are the higher frequencies. Now let's look at phase slope index, which we'll look at next. The delta phase slope index shows that there is a flow of information from CZ to FZ. That's what the red is. Here are the z-scores. That's 3 standard deviations. Here is the right frontal flowing to FP2, FZ flowing to FP2, C3 flowing to FP2. So the direction of flow is shown here, and the magnitude with respect to a normal population is based on the colors. Here's O1 flowing to FZ. Here's FZ is blue with respect to O1 because the information is actually flowing from O1 to FZ and not the other way around. Now here's the theta band where we saw before that coherence was deviant with reduced connectivity, and we see that the left frontal pole has a high information flow to C3 and F3, CZ, P3, and PZ, as well as FP2. And you see that P4 has very low connectivity or flow of information to its surrounding neighbors because there's high disconnection that we saw with coherence. So low information flow from P4 to C4 or CZ or C4 F4, and there is some flow of information to O2 from P4. Here's C4 is showing high flow of information from C4 to P4. And now as we go to higher frequencies, here's alpha, and it's fairly normal. The z-scores are within the normal range as we've seen. His problem is focal in excessive theta and delta, particularly excessive theta in the right parietal region. And also we know from the coherence that compensatory dynamics are going on here with the left hemisphere and the flow of information and the increased connectivity of the left hemisphere with respect to the damaged right parietal region.